President Trump on the verge of declaring the opioid crisis a national emergency, a move that would be unprecedented. And there are some concerns, even from the members of his own commission, that he may not follow through with a strong response. Joining me now is Indira Sidambi, addiction medicine expert and founder and medical director of the Center for Network Therapy, and Dr. Nicholas Kardaras. He is addiction expert and executive director of the the Dunes Rehab Facility. I have Devin Nunes on the brain because he was the congressman at the top of the hour. Thank you for being here today. So we expect that the president on Thursday is going to finally make this declaration. Do you think it's necessary, doctor?
I think it's a start in the right direction. I think having a national conversation and allocating resources. My concern is where those resources are going to be allocated. And so we've always looked at the drug epidemic, the war on drugs, as a supply side issue and not as a demand side issue. And so I would personally like to see that a lot of the demand side in terms of what's the underlying causal reasons that's driving the opioid epidemic, and not just look at interdiction or even treatment, because by the time someone gets to treatment, the horse has already left the barn. You know, there's a lot that we can do before it reaches to that level of an intervention. So I want to see more preventative types of measures in place.
And you're having a lot of success at your clinic, you told me, with actually getting people, if they are addicted, off of it and onto a sober life.
Yes, you're right about that. I pioneered the outpatient detox methodology in the state of New Jersey. It's been 4.5 years that I've been practicing in that clinic, and we see 65% of our patients who complete the program remain sober for 90 days and over. And it's a beautiful success, and they're able to go back and integrate into the community, get back into workforce.
But are you concerned that more regulations, more laws would actually hurt their recovery efforts?
Absolutely, absolutely, because if you look at 4 out of 5 violation of drug laws are due to possession, not due to sales or manufacture. Having said that, these patients who are seeking treatment, they successfully complete the treatment and remain sober, but then they are unable to go back into workforce because the charges that they incurred while they were actively using, come back to really bite them, and that has been putting a stop in their progress. That means it's the trigger for them to go back to using drugs.
But isn't it difficult then for doctors who, you want to help your patients deal with pain? And so if a person is telling you that they are in pain and you want to try to help them, do you have other options in addition to these medicines and trying to deal with the actual problem?
So the problem is that pain is one of the few self-reported illnesses. And other illnesses, a doctor could diagnose something using various quantitative measures. But with pain, it's client self-report. And so the problem that you have now is you have clients who, and I think we also need to sort of factor in the mental health aspect here. So you have a lot of clients, because the one research study that just came out from the University of Michigan and Dartmouth Medical School, over half of opioid clients have also anxiety and depression. That's a big driver to the opioid epidemic. So someone who has anxiety and depression is more likely to be a self-reporter of more pain. They have an amplified sense of their discomfort or their distress. Oh. So this drug-seeking behavior, potentially drug-seeking behavior, without any sense of control. I'm not talking about necessarily criminalizing the issue. Of course, I'm a treatment provider. We believe in treatment. But when you have a town like West Virginia, that is the #1 state in the union where people are dying. They have the #1 overdose rate. So you have distressed economies. You have a flood of opiates going into West Virginia. For example, there's a town in West Virginia called Kermit, West Virginia, that has 392 people. They had 9 million Vicodin pills went into that town in a 2-year period. Controlling that free flow of substances into vulnerable populations is, I think, is part of the solution, because you have vulnerable communities with this free access to self-medicating instruments, which Big Pharma has played a part of.
I only have a little bit of time, but if there was one thing that you could ask President Trump to include in his emergency declaration, what would it be?
That will be to really have do decriminalization of drugs, because that is a key. If we decriminalize, then the amount of money that is being spent for the criminal justice can be diverted towards the treatment. And I think that's important. And one big thing I want to bring to the table today is that addiction is a chronic disease. So we shouldn't be looking at this any different from diabetes or high blood pressure. So we shouldn't be talking about criminalizing these patients.
We're going to have to run. Thank you so much for being here. We'll keep talking to you about it.